Hello, everyone. Thanks for joining us today. Today's Cancer Care Virtual Seminar topic is Caring for the Caregiver. My name is Carmen Boone, and I'm Outreach Coordinator for the Samaritan Cancer Resource Center, and I will be your host and moderator. Today, our speaker is Heather Perue. Let's keep moving on with our slides. And just let you know that this event is brought to you by the Samaritan Cancer Resource Center. We partner with anyone touched by cancer to provide the support they need to live with strength, determination, and hope into the future. This presentation is being recorded and it will be posted in Samaritan's YouTube channel. We will post the link and more information in our monthly newsletter, so keep an eye on that one. All microphones are muted and will remain muted during this session. And please use the questions menu to type your questions and comments at any time. Time is reserved at the end of the session for questions and comments. And joining us today is Heather Perue. She's a medical social worker from Samaritan Health Services. And Heather, thanks so much for being here with us. And I'll go ahead and pass the presentation over to you.
So thank you so much for having me here today. This is a topic that is super important for providing care for patients that we see here. Specifically, my focus has been with the Cancer Center for Samaritan. And so that certainly is the approach that we're going to be taking today and why I'm happy to be here to talk about this. So being a caregiver is a key role to participants' care or patients' care, and support is crucial to the physical and emotional well-being of a person with cancer. Caregivers are often the one person that knows absolutely everything about the patient. So as we explore our opportunities to support our patients here in our clinic, we also want to take a look at a similar opportunity for us to enrich the caregiver's experience with who will also help to improve our patient outcomes. As Carmen already identified, as you get questions or things kind of pop up throughout this presentation, please jot them down in the chat. I'd love to be able to follow up with them after I get done today. So so our perspective is going to be from the point of view of a caregiver for a loved one experiencing cancer. However, many of these points can be generalized to all forms of caregiving. My hope is that we can enrich our understanding of this unique perspective and give practical tools on how to support caregivers. Okay, I'm ready for our goals today, what we're going to accomplish. So first of all, we're going to spend some time talking about who a caregiver is and how we define that, the impact on family and getting a cancer diagnosis, stress on caregivers in general, how to support caregivers through a cancer experience, what does it mean to partner with a medical team and how to interact with them to help support your loved one, how to also protect your health, and then I'm going to give you a bunch of resources at the end too. So let's jump in. So let's talk about who a caregiver is. So a caregiver is a person that helps someone. And in this case, it's someone that's going to be helping someone going through a cancer experience. So caregivers could be a spouse or a partner, a parent, an adult child, a close friend, coworkers, neighbors, anybody that's anybody can be a caregiver. There's also paid caregivers as well, and we'll talk a little bit about that later, but caregivers are just anybody that's around. So so what do caregivers do? This is going to be a list of things, but it's not, only identified as these. So many people don't believe or would consider themselves to be a caregiver, but caregivers help with illness, following treatment plans, giving reminders, or helps with medications. They cook meals, ensure that patients get enough rest, and offer emotional support. There's a whole lot of other things that caregivers do. They assist with bathing and dressing, feeding, picking up groceries, helping to pay bills, picking up prescriptions, managing side effects from medications, reporting problems to the medical providers, or scheduling or attending appointments, providing transportation or housekeeping. They make sure that the patient has everything that they need after once they were discharged from a hospital stay. Caregivers can also help the patient to decide treatment options, prevent mix-ups, and just keep track of paperwork. They also keep friends and family informed about what's happening. Okay, so being a caregiver is a very key piece to the patient's cancer experience. Many people find great satisfaction in caring for others, and it enriches their life. Caregivers may see it as a meaningful role that allows them to show love and respect to the person receiving care. A caregiver might also discover increased confidence, learned inner strength, improved abilities, and a greater sense of purpose of life. I want to move to talk about the impact of cancer on a family system or structure. So the next slide, please. One particular study showed that patients experiencing breast cancer identified that those who adjusted the best to their cancer experience were those who had the highest levels of family cohesion. Those with higher social supports also would experience fewer adjustment difficulties. So a cancer diagnosis can really upset the equilibrium of an entire household. The family's first impulse is to protect each member of the family, especially the member experiencing cancer. They often avoid discussions or feelings of problems and can isolate the patient. Continued avoidance and isolation created from that silence often creates difficulty fully supporting each other and continues to throw off the previously established equilibrium of the family. It's also not uncommon for extended friends and family to remain uninformed about a person's cancer diagnosis for years. Opposingly, however, there can be over-attention to family members experiencing cancer, and this can lead to neglect of other families' needs, especially younger children who are sensitive to the availability of their primary caregivers. So I'm going to take just a quick second to talk about the impact of children and adolescents when their primary caregiver is experiencing cancer. And so that disruption of the family equilibrium and availability of their caregiver might lead to unusual behavior from children or adolescents. They might be getting into fights, they might neglect schoolwork or not want to attend school, they might experience nightmares or develop somatic complaints, things like headaches or stomach aches, or develop regression in normal development for their age. They might participate in reckless driving or run away from home. The teen should be encouraged to participate in pro-social activities such as time with friends and recreation, which specifically includes physical activity, or maybe even attend their own therapy. The family function is deeply influenced also by ethnic and religious family cultures. Some cultures view cancer as a source of shame, with special focus and attention to the part or parts of the body impacted by cancer. Denial of illness can often delay patients seeking medical treatment, and some religions deny the use of using blood during surgeries. This might impact surgical interventions or even treatment options. Although asking patients about their religious preferences may be uncomfortable or unpopular, having this knowledge can help providers identify barriers or accommodations to support the patient's culture. Caregivers can also support the patients while they ask the questions like, why did this happen to me? Which is a very, very common question. Having the understanding of the impact of cancer on the family system can help caregivers and the medical care staff to offer support to patients as they adjust and establish new equilibrium to their life. A family actively working to reestablish that equilibrium is a family that's able to communicate painful facts and feelings and are open to outside support and are also flexible about adapting new family roles and rules. After receiving a cancer diagnosis, patients can also face stigma related to social stress. It may result in social circles feeling discomfort of being around the patient or increasing their social distance. And in this case, I'm not talking about the 6-foot social distancing recommendations. Relationships that were once close are now distant, and available supports may suddenly become unavailable, which requires an adjustment to available caregivers and resources. Receiving a cancer diagnosis can also bring up memories of other loved ones or close friends who experienced cancer as well. This can be an encouraging or hopeful time of overcoming a cancer diagnosis if the experience was positive and the cancer was defeated. Or it could bring reminders of losing someone to cancer. Caregivers may have to wade through these emotions with patients based on their previous experiences. I want to take a little bit of time to talk about stress of caregivers. And on our next slide, we'll look at that a little bit more. So a caregiver may experience feeling severe sadness and emotional distress while caring for a loved one experiencing cancer. Can I get it to the next slide, please? Thank you. Feeling grief or being overwhelmed and frustrated are also very common emotions to experience while caregiving. A caregiver may feel unprepared or unable to manage the responsibilities that come for caring with a sick loved one. Fear, hopelessness, guilt, confusion, doubt, anger, and helplessness are all feelings someone going through cancer can experience, and these same emotions caregivers can also feel. Helping to care for their loved one and care for themselves can be a very overwhelming task. Various studies show that anywhere between 38 to 60% of caregivers suffer from clinical depression. Things like ongoing sadness, helplessness, an empty mood, a loss of pleasure in fun activities that they used to really enjoy, weight loss without dieting, feeling restless, having fatigue or loss of energy, trouble sleeping are just the beginning to what this might look like. And also, the impact of depression is linked to immune function decreases, magnification of pain and disability. Pain increases the heart rate and blood pressure, and that enhances the stress hormones in the body. Those with depression are 4 to 5 times higher risk for heart attacks, and studies show that depression increases healthcare costs. Depression is also underdiagnosed and undertreated, and caregivers often neglect their own mental health and physical health and report increased stress. So this fact of how caregiving can increase our likelihood of depression is actually really important, and one of the reasons why we wanted to offer this training module to be able to help us identify ways that we can decrease those symptoms and be able to help folks out. Women also are likely to be caregivers to an aging spouse. And let's move on to talk a little about stress on working caregivers. So working caregivers often have less demanding jobs. They often retire early to be able to provide care more than what they would if they were working. They turn down promotions and career developments and advancements. They lose job benefits. They take time off frequently or take long leaves of absences. I want to shift a little bit now to kind of talk about communicating with the medical care team and what that means for the caregiver to join in. And we'll be able to find that on the next slide. Yes, that one. Thank you. So as a caregiver, it's important to learn when to call a doctor. So ask the nurse or the doctor about what problems should be called about right away, no matter what time of the day. If it's after hours, what's the number to call? If it's a holiday, what number to call, and having that sort of list of things to look out for is very, very important. If a patient needs to be moved or maybe relocated based on the caregiver's ability or inability to properly care for them, the cancer care team and the medical care team rely on caregivers' reports of their behavior that might indicate a need for that different level of support out of the home. Being a reporter of this experience is crucial to receiving the care the patient needs. Anticipating experiences throughout treatment, like an increase of anxiety or fear around scans, labs, and doctor visits, is also very, very common. We do offer some medications to be able to help with scans and things like that that make people feel claustrophobic and things like that. And so if you are caring for someone who is more prone to that, just know that there are some things out there and available to them. A recent study revealed that 30% of patients who are newly diagnosed with cancer were clinically distressed to the point of requiring psychosocial intervention. If receiving the news of cancer has such an impact, caregivers have an opportunity to come alongside their loved one for support. Encouraging and supporting your loved one does not mean that you act like a cheerleader, you're not a rah-rah, or attempt to make them feel good when they just feel really sick. Listening to and not talking or giving options is an okay response at times, but also listening with your ears and your heart. Give yourself and the person you're caring for a break from cancer talk. Often appointments, long infusions, tests, exams, and travel between appointments can consume all waking hours. Try to normalize the day-to-day activities. Spend time talking about topics unrelated to cancer. Participate in enjoyable activities or activities that can improve the health of both the patient and the caregiver. When it comes to making major health decisions, it's often helpful to have advanced directives ready and completed. A caregiver can be identified as maybe a durable or medical power of attorney if the patient becomes unable to make their own decisions. This helps medical providers understand how to better assist the patient in meeting the patient's wishes for their healthcare interventions. Interestingly enough, about 50% of Americans have had end-of-life conversations, things like advanced directives, but only 27% of them had formalized documentation of what they want, which really puts a lot of pressure on caregivers or the medical care providers to make decisions. Encourage the patient to identify someone to make decisions about medical interventions and honor treatment preferences early on in writing. I also have, I don't know if you all have seen, okay, let me get this into view. Whoop, over my face. This is the advanced directives that Samaritan offers patients. If you take a look at any of your doctor's offices, there should be some out. If they're not, then you can ask for them and we can provide them for you. There's some really good talking tips and encourage folks to have conversations with family members and things early on, and also an opportunity for you to formalize that in writing. It goes in your chart and all that stuff. So if you have not filled this out or want help filling it out, there's certainly folks available to help you with that too. So I also want to talk about attending appointments. So deciding when a caregiver attends appointments or that includes how to support during appointments, what questions to ask, and what support would look like for the patient is really important to ask. If a caregiver would attend infusion appointments, or when a patient isn't comfortable or isn't able to drive after appointments. It's okay to ask the silliest questions and take notes during office visits too. Bringing questions written down can be really beneficial, and avoid leaving the appointment with unaddressed questions. It's not uncommon for patients or caregivers to have questions going into an appointment, and conversations lead to other issues or topics, leaving the questions unanswered. Using some assertiveness techniques in appointments can ensure that the patient and the caregiver get their items addressed as well. If patients or caregivers continue to feel like their questions are going unaddressed, social workers can help them learn these new assertiveness skills, or can also help attend the appointments and advocate for those questions to be answered. Attending appointments as a caregiver is time to advocate, ask questions, and be heard, but it's also a time to listen in response. Taking notes is a good way to remember all the things later. I don't know about you, but I get in place and I go, I don't remember what they said, but if I took notes, then I can reflect back and listen. Often office visits can be emotional and really overwhelming, and it's hard to remember everything that was discussed. So the Samaritan Cancer programs offer some really amazing support staff. If there is a patient having financial difficulties or issues with medication or prescription bills, paying utilities, housing challenges, and Social Security. Also food or nutrition related questions, and things like emotional support or community connections, questions about hospice or palliative care. We have a whole team of folks that specialize in helping folks address those things. And so we have our patient financial advocate, our dietitian that has specific credentialing and certification for oncology patients, and also our social workers. Okay, I want to take a little shift quickly to talk about the not so great things about caregiving, and talk about hard decisions. So on our next slide, we'll go into that stuff. So there becomes a point at times as a caregiver where really hard decisions are necessary to be made. I mentioned earlier about the advanced directives, but having financial affairs in order, having a living will, having your advanced directives filled out can be really beneficial when it comes to healthcare issues and knowing what to do next. It leaves little question that of like what to do when we get there, right? It's already written out, okay, this is what we do now. Samaritan offers that advanced directives guide that I just showed you. We also, palliative care and hospice care are also available, and knowing when you might qualify or when you could benefit from that service is also a discussion that maybe caregivers can help with. And so it's important for us to have ongoing conversations and be aware of those services. Samaritan offers a really great palliative care service as well as our hospice programs. You can talk to your medical care teams about those options as well as social workers. I know folks that I've talked to, sometimes they're just not ready to talk about those things because it's overwhelming, but those services are there and available, and having an idea about how to access them is a really good thing as well. I want to talk a little bit about nearing the end of life and what that means for a caregiver and how that can feel. Things that maybe you can walk with the patient through. So making sure that the patient is emotionally prepared for death can be rather hard, or deciding where the patient will like to spend their last days. We have a really great opportunity through our hospice program, our Evergreen program, to have a hospice house. Some people feel very much at home and peaceful when they're there, but other people would really like to have their last days in their home. So as a caregiver, having those conversations, understanding the resources and are available are something that you can help the patient with. Helping a loved one resolve any unfinished business, like a last trip or a last hurrah, is something that can be really great to be able to experience with them. Supporting and advocating for the patient's last wishes, and knowing what to expect specifically when the patient's physical condition is near the end of death. These are all things that caregivers might experience, and there is help available to prepare throughout that process. This can be a really difficult process to experience or witness as a caregiver, but are included in activities that caregivers are present for. Having previous conversations with the patient about these wishes can help have a plan and be prepared for the end of life. Okay, enough of that. I'm going to switch. Let's move on to the next slide. Let's talk about what happens after you beat cancer. And as a caregiver, there's this belief of like, ooh, you're cancer free, everything goes back to normal, right? And the reality is that they can't. People that experience cancer are changed. I read a quote and I want to share it with you today. It says, "There was no moment of cure, but rather an evolution from the phase of extended survival into a period when the activity of disease or likelihood of its return is relatively small." So treatment may be over, but frequent or annual appointments with the patient will continue and will also require a level of support. Through periodic scans, tests, and exams, the fear of reoccurrence of cancer waxes and wanes, and caregivers are there through it all. This is an awesome opportunity for us as caregivers to come alongside our loved ones and help them through that time as well. And the lasting effects of the cancer experience include chemo and radiation side effects, medication side effects, emotional side effects of having to go through this rather traumatic experience, and also the thought of the elephant in the room of like, I had cancer. I had a breast cancer survivor say, when do I tell people that I had cancer? This is a thing for people that have this experience. And so being able to support people and empower them to share their story is equally important, and something that a caregiver can do. And then also this thought of like, this person is not the same. this experience has changed them is also something that caregivers can help with. Patients who are able to beat cancer report greater appreciation of life, time, and relationships. One study of patients treated for Hodgkin's disease found that a number of self-reported value changes had included these following value changes. Patients changing their philosophical meaning of life, changing their self-concept, and changing their view of the importance of relationships. These are pretty big life shifts and values. And as caregivers, we are there and watching and observing and supporting all of these. While patients reevaluate their priorities, caregiver support is crucial for ensuring that patients feel like they're getting the support that they need. It's also not uncommon to experience a loss of intimate relationships, friends, and family after experiencing cancer. Divorce seems to be a drastic change during the cancer experience, but it's also not uncommon. There may be times that when someone wanted something in life before cancer, and now after cancer, it is completely different and shifts. Giving that person permission to reevaluate and come up with where they want to be can be really disruptive to previously established preferences and routine. We're talking about the same equilibrium of a family structure that we mentioned earlier today. This is all like jumbling it all up and rearranging it. The person will never be the same again, and neither will their caregivers. This experience can seem erratic and out of control because there's just so many unknowns about having cancer. But careful attention and support through this redevelopment and reestablishing of equilibrium can help ease the adjustment. After completing cancer treatments, a patient may seem changed and a different person who has different priorities and different perspectives on life, and a caregiver can be instrumental in supporting the patient through this evolution. Okay, let's talk a little bit about protecting your health as a caregiver. So we're going to see that on the next slide. Thank you. Although caregiving can be very, very positive and bring back a lot of positive thoughts and emotions, the side effects can also be damaging, and we've kind of already talked about those things. But being proactive in taking care of your health is key. If you aren't already doing these things that we're going to be talking about, look for ways to incorporate them into your life and encourage the person you're caring for to participate too. They can also benefit. There's two different approaches that I want to talk about today, and really it's just kind of preference, and they all kind of sound the same and mean the same, but sometimes it's just how you're going to remember it. So the first perspective is the 3 activities. So the first activity is an activity that involves other people, like having lunch with a friend or doing something with somebody else. If you're going to go antiquing with your aunt or something, doing something fun that brings you joy. Activities, which is number 2, that give you a sense of accomplishment. So maybe finishing a project or quilting or knitting, something where you can wrap things up that gives you joy is a really great thing too. The third activity perspective is that it's something that helps you feel good physically and helps you feel relaxed. So that could be exercising or yoga or watching a funny movie, things like that that bring you a lot of joy. Those 3 perspectives seem to be kind of fluid, and it varies based on a person. And so some people really need a little bit more concrete direction of things that they can do, which is why I have the second perspective. So there are 5 tips to promote your health. So the first one is eating well and avoiding alcohol. Okay, we already know that, but how many of us actually do that? We'll work on that. Number 2, exercise, something that makes us feel good and helps our bodies feel good. Protecting your skin, things like wearing sunscreen when you're outside, avoiding tobacco products, and tend to your mental health. We're going to talk more about that here in a couple slides. All right, so what can we do about all this stuff, right? So hope is a critical component for successful adaptation to cancer. The level of hope and the ability to cope with it are all interconnected. Finding intentional practices that bring hope and help cope is an individual's own discovery. There are a lot of really great ideas available, and I'd like to share some ideas with you as we near and wrap up this thing. We still got a few minutes, so hang in there with us. So caregivers can help their loved one live as normal as possible. They can encourage their loved one to share feelings and talk about their experience with cancer, be available for their loved one, but also not pressing. Caregivers can also share their own feelings and experiences. It's okay to feel sad or frustrated, anxious, or afraid. Help is available. Watch out for social cues that the patient might need and understand their communication style. It's very important. We also want caregivers to be realistic and flexible, and remember that everyone also needs some alone time. It's okay to leave them alone for a few minutes. But what about coping as a caregiver? So let's talk some more about some specifics. And I think that some of these seem to be a little bit more practical, especially with my experience of working with caregivers and trying to help their needs get met as they're caring for their loved one. So your own mental health and safety have to come first if you're going to be able to continue to provide care for your loved one. If you're feeling stuck, reach out to someone you trust. It's okay to not be okay. It's okay to have hard moments, and it's okay to want a break too. So take a break. Being a caregiver 24 hours a day for months and years is nearly impossible. So even if there are many caregivers early on, really do need to take a break as well. So know your limits and try to avoid doing it all. I know that there's so many people that just want to do it all, especially if you have a physical condition. So pull in the troops to try and help you. Ask others to help as well. Identify your limits and ask others to fill in where you can't. Sometimes that could be the hard part, though, is identifying where you can't. Ask friends or family or even neighbors to help. Asking someone to help vacuum floors or weeding the front flower bed can be a really great way for those who care for you to show up in ways that help them feel like they're also helping out. Family meetings can also be helpful for identifying ways others can help, and this is a way for everyone to use their skills and strengths. I think my experience has been that a lot of people are willing to help, but it's hard for them to ask for help. And so this is an opportunity for us to be vulnerable to the people that we love and we're close to, and say, I really need help with this thing. Can you come over once a week and vacuum my floor? Because it's just so hard for me to do. Those little tiny things really do matter. It helps the people that are doing those tasks feel like they're contributing, and it really helps the people that need those tasks done to feel cared for. If there aren't people around to help give a break or any of these other things, you might consider hiring a caregiver for a few hours a week. Those resources are available. Also, consider hiring a gardener or a housekeeper to help out. Though if you have financial means to do that, that can be a really good benefit as well. Also, find support yourself. Individual therapy or caregiver support groups are a great way to find that support. It's someone to talk to help cope with emotions that arise during caregiving. Contact the Cancer Center for help too. Carmen, who we met earlier, is a go-to person there. And they have a really great staff, and they want to help people. So that's a really good resource as well. There's also social workers connected to all of our cancer sites. And so if you're needing extra help with that sort of thing, please reach out. I want to talk a little bit about self-care right now. I know that's kind of a buzzword at the moment, but self-care isn't just, I'm going to say, me time. It's not pampering or massages, even though it totally could be that. Self-care is also not just about feeling good, because some things you do for your health don't feel good. Eating broccoli might not feel that great, but it's good for you, right? Self-care is about doing something to improve the quality of your life by bringing balance, meaning, purpose, and fulfillment. Self-care can also be forgiving mistakes you made in the past or forgiving others that you've held a grudge against. Setting boundaries in relationships, getting an extra hour of sleep. Hello, I think we all need those things. Making a medical appointment that you've been putting off, like going to the dentist or doing your yearly exam. Drinking water, that's one thing that we forget about, that is one way to take care of ourselves. Maybe quitting a stressful job or ending a hard relationship is also a form of self-care. There's also some other tools like meditation, prayer, or spiritual supports. There's also breathing exercises and relaxation techniques. There's some guided breathing or some tapping, and I'll talk about that here in a second. Also taking medications as prescribed are all forms and things that you can do to help out and be able to show up as a caregiver. Okay, we're almost done, folks, and we'll open it up for questions. My next slide, I wanted to talk about this new opportunity that we have. One of the things that you heard me talk about is finding a support group. And so Samaritan is starting a Caring for the Caregiver support group. This is specifically for caregivers, for folks that are helping their loved ones with cancer. And remember, you don't just have to be the spouse. You could be the daughter, you could be the aunt, you could be the neighbor, you could be whoever who is providing support for someone experiencing cancer. And really, the purpose of this group is to give caregivers a structured break. It's the respite. It's the, okay, I'm going to take an hour and a half out of my day to build myself up and show up for myself. It is an opportunity to practice self-care. It's a safe place to talk and process and listen. It's a place to develop a community of people that understand the impact of caregiving for someone experiencing cancer. This is a very unique experience, and we aren't all honored to experience it. And so if you are a caregiver and you are caring for someone experiencing cancer, this is something that we can participate in to help us feel like we're not so alone. It's also a place to give back and share your experiences and knowledge, provide words of encouragement, and problem solve difficulties other people are facing. There's lots and lots of studies out there that talk about the great benefits of volunteering and being able to give back. And so hopefully in this group, we can also feel like we're contributing and giving as well. So that is actually starting. Our support group is starting next Wednesday. It runs from 1 p.m. to 2:30, and right now we're doing it virtually, and it is the first and the third Wednesdays of each month. So if you're only able to make it to one, that's great. We want to provide an opportunity and some consistency to be able to provide a place for folks to meet and get together. So, okay, last slide, please. This might be my favorite of slides, where I get to talk about all the fun resources, aside from the available staff at Samaritan to be able to help through this and through the Cancer Resource Center. There's also some really great resources available for you to access on your own. So I'm a young person, and so I'm in apps and things like that. And so one app that I really love is the Calm app. There's some breathing things there that can help you, relax, can help with sleeping, can help with, waking up and preparing for your day sort of thing. It's really great. There's also an app called Headspace that is also a really great app too, I would recommend. The Tapping Solution app, and you have it here on your screen, is also a really great tool to help relax the body when you're really stressed out. And it helps you go through those things. I really like it. The Cancer Resource, or American Cancer Society also has a really great resource for caregivers. You can just, Google American Cancer Society Caregiver Resource Guide, and it pops up as an app. I think Carmen is also going to be sharing my slides, and so I believe you could click on that link that I have on there and access that. It is a rather large PDF though. It's like 80, maybe more than 80 pages, but also some really great stuff in there, and some of the things that were in there I've also included here today. But I also have some books. So I'm a book person. I want to smell it, and I want to turn the pages, and I want to experience this. So some folks are Kindle or electronic or whatever. I'm sure you could find these on there. But the first book that I want to share with you is the Toolkit. Ooh, here we go. Toolkit for Caregivers. This is a really great opportunity for you to like look at how to shave somebody's beard or how to change out a dressing. The author is Deidre Edwards, and she was a nurse, but also cared for her ailing husband. And so there's all types of like really great techniques and things to help with. So if you're a caregiver and you're like, I don't know how to properly bathe someone, all of this information is in there. I really recommend it. Okay, the next one is called Helping Yourself Help Others by Rosalind Carter. Okay, this is what it looks like. I got these books off Amazon, but I'm sure any book carrier you can find them at. This is more thinking about how, as a caregiver, I can show up to the person that I'm caring for. There's some really great things in there. This book is a little bit older. It came out in the 90s, I think. So not that that's very long ago, but anyways, there's that one. And then my last and favorite book, as a person that has been involved with mental health services for years and years, this is my go-to book. It's called The Self-Care Prescription. And this is a really great book. I don't know if it could be like a journal, but it's really like a practical book where you kind of talk about what your priorities are and how you want to show up for people and how you want other people to show up for you and how to communicate with the people around you, what that looks like. Also gives intentions for where your values are and things like that. And so it really does look closely at who you are and things like this. This is a pretty new book. It just came out maybe a year ago. But I really like it a lot, and I encourage you to pick that up if you are a caregiver. There's definitely some hard questions in here, but I think are really great for this time. So anyways, the last thing is, if you're interested in doing some mindfulness techniques, things to kind of help calm you down. I know that as a caregiver, you can have some really intense emotions and situations. So in order to calm yourself down and to be able to show up for the person that you're caring for, that mindfulness and relaxation, some breathing techniques are really great. And for the sake of me being young and saying, just go to YouTube, just Google in mindfulness or deep breathing, or, and there's endless possibilities. So if you are not in a financial position to like pick up these books and read them, there's tons of stuff free for you. So I do think that the Calm app and the Tapping Solutions app, and I know for sure the Headspace app does ask for like charges throughout it. There's plenty of things on there that won't charge you can do for free. So things are at your fingertips if you have the resources to do it. So I'd really encourage our caregivers to use those things. And even if you aren't caring for someone experiencing cancer, these are all really amazing tools to be able to incorporate and bring value back to your life. So, okay, I'm going to stop jibber jabbering. I feel like it's gone on way too long. I hope you're still with me, even though I can't see you. My contact information is here. My offices are in the Lebanon Hospital as well as the Albany Infusion Oncology buildings. And so I am there. You can contact me by email as well. If you need to get a hold of me or ask a question or anything like that, I am here and available. I'd love to connect with you and chit chat. So, okay, Miss Carmen.
Thank you so much, Heather.
Yes.
So now we'll give our participants a few moments to write any questions and comments in the questions menu that it's on your control panel. And while you are entering your questions, we'll go over some contact information and upcoming events. Please write down Heather's number and email address if you're interested in joining the caregiving support group. please call her, email her, and she'll send you the link to participate in the support group.
Yes.
So now, if you'd like to obtain more information or resources about cancer, feel free to contact the Cancer Resource Center by phone, by email, or visit us at our offices or our website. We have a library, so you can borrow books from us. If we don't have them, we can order them for you so you can borrow them. Here's our contact information, our website, our email. We have two locations, one in Corvallis and another one in Oregon. Both locations have libraries, and you're welcome to borrow books or just go there and read the books there if you like to have a corner away from home. Send us an email as well. And now we are in social media, so you can find us on Facebook and you can find us on Instagram. And contact us as well to subscribe to our Cancer Resource newsletter. Okay, now couple of things that are coming up. If you're interested in joining our upcoming virtual cancer care seminars, email us or call us. Our new upcoming events are Creating Hope. It's an art workshop. It's on April 1st. We have Health Insurance 101 on Thursday, April 21st. And of course, you know already about the support group. So now let's go over any questions that you may have, mainly comments, expressing thanks, and appreciation for Heather sharing her time and her knowledge with us. If you don't have questions right now or want to process the information and then ask, you have our contact, so feel free to do that. Please, if you have questions to be answered privately, email us at the Cancer Resource Center at samhealth.org or at Heather personally. All right. Let's see. And now, please, just a reminder, fill in the survey that it will open up after the webinar has concluded. And thanks so much to Heather, our speaker, for sharing your time and knowledge with us. And finally, thanks to all of you for participating today. You may now disconnect and have a great day. Goodbye, everybody.
Thank you.